I want to thank everyone for joining us today. This is for our September Parkinson's Journey program in partnership with the Inova Parkinson's and Movement Disorder Center, the IPMDC. Today's session is kind of a unique take on our expertise as people who specialize in Parkinson's, because we're going to talk about how you adapt your exercise when something happens that maybe is not related or could be related to your Parkinson's. So when your health changes, your exercise will change. And for today, we have Josefa Domingos, a physiotherapist who has been specializing in Parkinson's since 2004. And I'm John Dean. I'm a speech language pathologist. I also specialize in Parkinson's, exclusively in Parkinson's since 2007. So maybe without further ado, we'll get rolling in here.
The idea behind this talk was really to brainstorm with all of you on something that I don't think the scientific community has really thought about. And I will get into that. Our goals for today will be really to focus on, can we identify situations where people might require adaptations to their exercise routine that they are doing? And then can we think about practical strategies that can help that adaptation? Now, we live in a time that's particularly interesting. So I've been working in Parkinson for maybe over 20 years. And when I started, this notion that almost everyone that we know now with Parkinson is doing some sort of exercise routine, which is a magnificent change. So we have invested a lot of time and research to also support that, to favor that people do exercise. As this is happening, new things are I would say, emerging as questions and new challenges. And I think this is actually one of them, which is what we know now. We know exactly what to tell people what to do in terms of exercise, but we should be able to better accompany people throughout the progression of the disease so we can help you change it when needed. So let us reflect on this today, but starting off by, when does a person with Parkinson feel the need to change their exercise routine? Okay. If we start off with that question, I can summarize it by thinking, you know what? It's people change because they're forced to change, right? There's something happens and that makes them change their exercise routine. And there has been identified, backed up by research, is different factors that might contribute to that. So you have, for example, there you have personal factors. That means you don't feel that you can do it any longer. You don't like it any longer. So very personal issues. You can have environmental factors, maybe it's the weather that's continuously something going wrong, and at this moment all the fluctuations that we have, or maybe the gym moved place and now you have the transportation to get there is much more complicated. Program design, which is actually a quite recent new factor that has been identified, is maybe we are changing so much things in the way we are delivering the programs that might not correspond to what you need at that moment. Maybe it's groups that we keep adding and adding people. So you've got a group that started out, I don't know, maybe with 10 people and now it's 15 and now it's 20 and now it's 30 and now it's 40. So several barriers, right? There can be, but we are going to focus today specifically on, I think, the one that will probably influence most these changes, which is obviously the disease and health factors. So when there's a change in health, this will be definitely our focus for today. And we wanted to understand if this was actually a problem, right? So, I mean, sometimes we think of something, but maybe it might not be such an issue. And from the questionnaires that we gathered from you all, which I really appreciate because it really brings it brings your voices into this talk. And so 41 people answered. Thank you so much. And what they reported, we have about 34 of those people said that they had to make a change. Okay, so it's something that is happening. And we were curious to know more about, okay, in what situations would this be happening? And I grouped it into 3 sections. This is, as I got your responses, these are the sections that I divided into. So one would be, okay, in situations where you have natural progression of the disease. We all know Parkinson is progressive, so we know that changes are going to happen, right? And then there are new problems of Parkinson, or what we call crisis moments, that can also appear related directly to Parkinson. And then there might be other issues that might happen, and I want to give you examples of each one of them based on the answers that you gave me in the questionnaires. So several people wrote in what made them have to change, and these were some of the answers that I will put into their places. specific categories. So we have, for example, in this category of natural progression of disease, someone that's referred to, I had weakness on my right side, and that made me have to change the exercise. I have trouble with breathing, fatigue symptoms accelerated slowly. So the fatigue has a keyword. A change in medication. So in Parkinson, we have the symptoms, then we have the medication, and then we have the side effects of the medication. There is a lot that people are managing in order as the years go by. And another one that references and reinforces the fatigue again coming in. So the person might be feeling the impact of being more and more tired and maybe not being able to be at the same level of intensity of exercise that they were doing before. We had one more here. So if I do more than 2 active times a day, I'm too fatigued. Okay, reinforcing what I just said. What was examples of new problems or crisis situations? When phenomena like freezing and freezing of gait is the sensation that your feet are glued to the floor. It is considered a complication that can happen. Okay, so it's not like something that we would expect, but it can happen. And the person also having changes in their lumbar spine. This was one reference. And then another person said, my big toe on the right foot became arthritic and the pain was preventing my 4 years of faithful power walking for Parkinson from continuing. Okay, so there we go in that expression that I was doing so fine. I had my power walks, and now because of this pain, I have to change and go for another option. I fell and injured my back. There were actual several references to falling as a crisis situation. So, and then we have other situations that might arise, which might be things that are out of our control. We're already dealing with Parkinson, and there comes something else, which could be an example like cancer treatments, starting surgery, mastectomy, here recovering, and possibly chemotherapy as well, referenced by this participant. And then we also had several people that said that the COVID was one of the major reasons why people had to change their exercise. Not only because we were at home, but also because it has a severe impact on health for all of us, right? In terms of fatigue, for sure. Another example was, so operations, surgery might come up for several reasons, but here we have the example of prostate and hernia. We have care partners also, an accident and disability followed by house repairments consumed a lot of time. So life happens, right? Life happens means lots of things that we don't control that can really interfere with what we have on a daily basis. There are 3 here that I included that can be a mix. So it's not black or white. It's not so easy to just put things into a certain category. They could be related or not related to Parkinson. But for example, shoulder replacement. I mean, it could be from an injury of something, could be from just rigidity that might evolve into a problem. So these are typical examples that maybe people might be dealing with and that would justify the changes. All good? We wanted to understand as well the impact that this might have. And I'll just give you two quotes here. Someone said, I was desperate to find a solution because I knew I had to exercise to survive. This really reinforces the moment of history that we are, where people are really aware that exercise is relevant in terms of staying well. It's very present in this sentence. And another person said, I had to adapt. I could no longer do the exercise I had done previously. So I do find that people will naturally find a solution. So I don't want here to state the obvious. But let's reflect on if there is something that we can do, and above all, learn from each other how people adapted. So thinking about what did people do? And we have different options. Of course, we gave you some examples in the questionnaire, but the one that was most highlighted, and I think it's obviously, it will be number one that comes into our head, would be I changed the type of exercise I did, right? So if I can't walk, I can't power walk now, so I'll just change, maybe I'll do bicycle. And the other one that was highlighted, I sought professional guidance. So yes, the professionals exist. We study these things on, so we have the responsibility of giving you that guidance. So we hopefully people can access professionals at this moment and can get that guidance. So let me just highlight here some examples of other options that people said. I consulted with my trainer. Most people are training with someone, so it's like exercise professionals, that's good. Or having access to occupational therapy or physiotherapy, or indoor or outside.
Yeah, yeah. It could be in the home or it can be like home health, or this is an outpatient. And skilled rehab is kind of like a middle ground. It's a little bit more intensive than outpatient, but not as intensive as being in the hospital.
Yeah. So by giving you these questions, we already want you to reflect on a little bit of what are different options. It's like I don't have to randomly create what I need to change. We were also curious to see how people were deciding on these changes. And I was somewhat happy to see the results, which means it really validated the talk, which means lots of people, 66% of the people said that they were doing non-decision based on error, right? So trial and error, which I think would be the first option. Let me just change something slightly and see if I can endure. And hopefully, when I say validate this talk, is that can we help people think of things like checklists that they can help them when they're making these decisions? It brings on the responsibility of giving you more knowledge so that you can be able to manage the disease and the changes better. Okay, typical advice from neurologists, which is surprising, which is very interesting because doctors tend to have little time in their consultations. They really have to focus on pharmacological interventions. And sometimes a little bit of time is left for exercise. So it might be just a general recommendation. But hopefully they are getting on board onto the exercise wagon. So it's wonderful to see that change as well. More in the US than in Europe, I must say, but I'm sure, I hope Europe catches up soon. The doctors are more serious here. Not more serious sounds bad. Sounds the comparison.
There's a kind of there's a kind of hierarchy that they observe that I don't see in some other locations.
Yeah. Okay, so let's think about when we do have a situation where something happens in Parkinson and you go to the neurologist and he has these options in terms of medication. And if we think about exercise as a medication, as you have heard this analogy often, what exactly can the doctor do if you have a new problem? So let's think about the options that he has. He's either going to increase the dosage of the medication that he gave you. He's either going to reduce that dosage, or he might change the timings by, usually it's more reducing the interval of the time so that your medication runs longer. But that doesn't mean there can't be strategies in the opposite direction. So let's leave it open on that. He can change the frequency that you might be doing. Maybe instead of we can divide the dosage that you have into a greater frequency. What else can he do? He can add in another medication. And then obviously you do have the option of he does nothing, and the fact that he might do nothing because sometimes we might not have options to change. It won't obviously be applicable to exercise, this option, but sometimes a problem in neurology is just if it really has an impact on daily activities. So the relevance that the neurologist might give to an issue, if it's really impacting your daily life, because then he would always be changing everything, right? So hopefully people can understand that we try to keep people stable as much as possible. But jumping on to, so exercise, if we look at it the same way, we have different types of interventions. And when I say exercise, like rehab world, and inside the rehab world, we have different exercise options and strategies and activities that we do and we adapt in terms of exercise-based interventions. Okay, so hopefully I've covered most of them here. And so now if we try to apply the same questions, is it valid? What can we do if we are facing a situation where we need to change our exercise? So we try to create a checklist for you. I must say this is a very new area. It's like a reflection, as I'll share with you. So this was just the first attempt to give you something that would help maybe guide any decision that you have. And you will have the slides after the talk. So hopefully you can use this. And the example that I just want is like thinking the same way, dosage, what can I do? So imagine I used to do my walks and now I have this pain and I can't, how am I going to, which of these options that I have would be better for me, right? So we just go through the list. So maybe the intensity of the walk, would that make sense? So let's think about it. Maybe the person can walk 30 minutes, but not an hour, because after an hour, maybe the pain sets in, like back pain. I'll just give you examples, not to be the same example. So if I'm doing a daily walk and I start having back pain in an hour of training, maybe if I reduce it into 30 minutes, that means I can still get the benefit. And then maybe I can think about why not do 2 different cycles of the walking and I'll get my hour the same, right? So these are ways that we can just brainstorm about how we do it. And I must share with you, like one of the new research that everyone has been somewhat playing with, I think, or it's almost like it is hard to believe that 1 minute exercise of intensive exercise spread out throughout the day has similar results as 30 minutes together. Isn't that amazing? So for those people that really don't have, that usually say they don't have lots of time, or maybe they don't feel that they can endure 30 minutes. So spreading it out, apparently there's some pilot studies that are showing that it could be similar. So I think research really exists to help guide us better on the recommendations that we give. And it's good to see this come out because it really helps. I'll give some comfort to people that are maybe not able to do those guidelines that are prescribed, right? Those 150 minutes per week. That sometimes can be too much for people. All agree? Okay, so we're thinking about a specific. We're gonna use this throughout the talk with examples, with different examples. But for now, so the format in which I was thinking about the walking, the time of the sessions, choosing the moments where the medication is working best. I will come to that in very specific the reasons why this would be important. But this is a recommendation that we often do. How realistic it is for everyone to place their preferred class of exercise or their preferred exercise or getting to the gym and having access to the treadmill if it's all full of people when you are on. It sounds easier than it is, right? We'll reflect on those things. Okay, so moving forward, let's grab onto examples of each one of these situations and hopefully transform that information into something more practical and that you can use. I've touched upon this, the idea at this moment that we have knowledge and research enough to support guidance in terms of research in different stages of Parkinson, right? So we have recommendations that we tell people, and the general one is the one that I said, 150 minutes per week, 3 times a week or twice, so people can change it. We have strength, we have balance exercises. There's recommendations that you hear often in exercise talks, right? What we don't hear so often is, okay, so what happens if I need to transition from one problem to another? So when a new problem shows up, how do I adapt my exercise? Is actually a gap in the knowledge that we do not have. And we hope that this starts a conversation that maybe we can stimulate more research on this. But the truth is, if we think about it, we know that Parkinson is a slow progressing disease, right? And if our health is expected to change, we know this, then we should also consider my exercise should be changing. And now, how do you know when that should happen? Okay, that's a key message. What we will do, we will think about these specific moments. So what would be included in continuous changes that you can expect? And then what are these crisis situations that can also occur and how we can relate that into exercise? There's a key message. There's something that worries me as a professional is sometimes new recommendations come on and we might not be fully reflecting on the impact that they have. And I've heard from several people how frustrating, how annoying, how irritating it is to continuously hear health professionals say, exercise, exercise, exercise. And every time they say exercise, they repeat it 3 times. I've heard this so much that I have to share with you. It's amazing how many times.
Well, especially because which exercise and how are we doing this? And then you get a change like this, it becomes a real.
Yeah, so I just think how we give in the recommendations, and obviously you guys will all agree that we are just trying to help people with Parkinson, but we also have to be mindful about the impact that we do these recommendations. And this actually brought to me this thought that we teach people that, Parkinson is a slow progressing disease. There are changes that are expected. Let me see if the video plays and you can see it. And then what happens is we have something that is going to change. And the concern actually comes in this. Let me just lower the noise. When you go to the neurologist, basically like 6 months, or in Portugal, they actually go 3 and 3. It kind of like depends on the severity or how people want to be followed, but they do have that option. And the doctor asks you to do these tests. He's measuring what disease is, how the disease is progressing, right? So he's measuring how slow the movement is, the amplitude, the rhythm that is done in these movements that are controlled by the area of the brain that has been affected by the lack of dopamine. Okay, so these tests, this is just one example, and this is how he monitors how your disease is progressing. If something should change that, then that means that the person is following a different route of progression, right? And I wanted to reinforce this because I saw this in this quote from someone from the questionnaires, and it really impacted me. The person says, "It impacted my confidence in slowing progression of Parkinson. I'm concerned about time to regain pre-treatment stamina." So by us reinforcing how important it is to do vigorous exercise, we might be contributing to the fear that when something changes, that I'm not able to do what I used to do. And so by that, I might be hurting myself in terms of fighting against progression of the disease.
Kind of an all or nothing at all mentality, and that's just not going to work.
So by this, I'm not telling you to exercise. Guys, that's not the message, please. We do want people to be motivated, and we do want people to push themselves as much as they can. But we can only ask that people do what they can in the situation that they are. So if ever somebody feels like makes you feel like you're failing something, please don't allow that to happen, because it's whatever something new happens, if you are using the tools to fight against whatever is happening, it just places you on a new way for things that are unexpected in life. Lots of things happens in life. It is amazing how we can live comfortably with all the unexpected things that can happen, right? All agree? Okay, so now let's think about solutions. We know that this is a slow progressing disease. Eventually I'm transmitting the idea that do keep alerted about when would it make sense for you to change exercise. So I do want to give you a tool for that. And this is, again, something in terms of questions that I thought would be relevant for you to think about. Like when you go to the doctor and they ask you about your exercise, or you go to the therapist 6 and 6 months, right? It's the recommendations currently is that people are followed by a physiotherapist 6 and 6 months, the dental model, right?
Yeah, and that's just a Portuguese turn of phrase. Every 6 months, but 3 is pretty much. It translates directly to the Portuguese. Every 6 months, nothing to worry about there.
So every 6 months, people are recommended to be seen by a professional that can help you in these decisions. And basically what we are doing is monitoring how the disease is happening and if some changes are needed. But this is, I think, questions that people can ask themselves to just be sure that you keep updated on, okay, this exercise is still working for me. So is it still effective for your health needs? So I want to improve my walking. But what I'm doing is maybe something that is not actually training walking. Maybe it's, I don't know, maybe it's, most of them translate into walking. So I gave a bad example here because almost dance, boxing,
Speech,
pickleball, everything, as long as you're in the standing position, it's gonna transmit. But so I'm thinking, I don't know, maybe stretching on the floor or something. and you really love stretching on the floor and it's your thing and you don't want to do anything else and you say, this is my exercise. But if you really want to improve your walking, the best exercise for improvement of walking has to have components of the walking, right? So you see, helping people understand how, if what do you want and how can we better help you? Which exercise will help me best on it? Okay. So how do I know if it's effective? I've created here also thinking, how do you feel after it? So we shouldn't be feeling so exhausted and so sore, even effects on mood after. I'm expecting that people perceive the benefits and feel good after doing a workout. That means the dosage is right. And so no pain, no gain. I honestly don't believe in that because motivation is an issue in Parkinson, and keeping people motivated is helping them feel that they are able to control the situation when they go to exercise, that they're not going to be exposed to exactly the same thing that they were the day before when they were feeling better, right? So having control over that and flexibility is very important for motivation. So you can go through this calmly, but I'll just go through quickly. So is it safe for you? So safety is an issue. Sometimes, as I was giving the example of the group classes, might become so big that you might feel that you're in a place that's so crowded, you don't feel that safe anymore. Or maybe the type of exercise for some reason is not resonating with you. So you might not be enjoying it so much. If you say yes to any of one of these, it's time for you to stop and to think about why. And then if there's something that you can do to change that. Good. I think all of the questions are equally relevant. Let's think about those changes. So what can we expect with Parkinson? And I know people tend to run away from talking about progression of the disease, but I think we are in a time of knowledge that it's more helpful to help clarify this in a positive way, and things that we can actions that people can do, because I have the privilege of working with people throughout their disease. So if somebody comes into my caseload, they will stay with me unless I do a really bad job or something happens. But usually if everything goes well, they stay with me and I accompany them throughout the disease. Which means I understand the power of trying to transmit to them what you need to know about Parkinson's so that you can feel comfortable that when something happens, you know what it is, you can recognize it, and we don't increase the fear of the progression. So I hope this tragedy works and resonates with you guys. And I think one thing that is important to transmit to people, the medication is considered in the medical world to be highly efficacious, right? So it helps in very specific things like the rigidity, the slow movement. It's very well studied for that. And what we can expect, that it has its limitations. So after a couple of years, and I think even this couple of years is questionable, because in young onset it might be different. If you are a woman, it might be different. So what we expect is that the medication will have intervals where it's working. So the doctor might prescribe 5 in 5 hours. Am I saying every 5 hours?
Every 5 hours.
You see, I can learn. So every 5 hours, you take your dosage of your medication. And if we think about these intervals, why is he saying this? It's because the medication lasts that long, or he's predicting that it's going to last that long. If everything goes well and he has hit right the times, you probably won't even feel this effect, right? So what we want is for you not to feel this difference where the medication is working or not working. We want it to always be working. And they fight for that. When they increase the dosage, reduce the intervals, this is their focus. This is the focus of a neurologist, to help you stay well continuously. But unfortunately, there's limitations to the medication itself. And there's also limitations in the natural progression of the disease. So the medication is not so effective anymore. And what we want is for people to recognize that this might happen and that there's always something that you can do, which is adjust the medication. So it's one of the diseases that most has changes, continues on the to fight against this problem, this gap. So we think about these issues and what can people expect in these intervals, in these spaces that we see here can be particularly different. So maybe 10 years ago, when I would hear we would be focusing on what people should be expecting is to become slower or more rigid, or maybe feel a little bit out of balance. So that's all the core symptoms that you hear for Parkinson, right? The rigidity, slow movement, and eventually impacting your balance. But the truth is now with more knowledge that we have non-motor issues that also have been identified as what we call the end of dosage. So that means that when a medication might not working at its best, that people might even have an increase in anxiety, right? Or even feel, why my mood just changed and I don't know why. There's these moments at the end of the afternoon where I'm not feeling so well, and it could already be a sign of maybe there's an adjustment that is needed. Okay, so I think this is relevant information to help people then understand changes that might occur. And on trying to bring this into practical sense, what can we do about it? So knowing that this can happen, can we think of strategies that would better help people to deal with these moments?
There's a little something in here about the speed increasing. And I think that's talking about the speed of how fast things are progressing.
It's I can give you there's different profiles that have been identified. Genetics comes into play. There's a lot of factors that can play into into us knowing and predicting how fast people can progress. Believe me, it's a complex topic, and it would take me quite a while to do it in a sensitive way.
One thing, and this gets into other lectures we've done, is if the speed of its increasing has happened very suddenly, that probably points to a crisis or something like that.
That we'll touch upon in science. So it's expected to be a slow progressive disease, but then there are elements that can happen and they can change the speed. And that would be but we do have now more information to help guide the better answers to that.
Yeah.
Okay, so let's think of this example where what we call wearing off. So that means the medication at the next time that you are taking the medication, you're feeling that close to maybe half an hour before, 20 minutes, 10 minutes, that time unfortunately may increase. You're feeling not the same. You feel more rigid, you feel more unsafe, you feel more anxiety. So those, and fatigue as well. Fatigue is a key issue here because your body's not responding so well. So we're looking at our checklist that we created, and can we think about ways that we would adapt our exercise according to this? If I'm having these moments, options, these are only suggestions, and you have to think about if it's applicable to you. Reducing the intensity, maybe how much amplitude I can do. So I can do a movement that I'm in a class and I'm following the teacher and I'm doing my big movements, and I can put more or less effort into it. That's my decision, right? Hopefully the teacher's not correcting you continuously and in an obsessive way, but but even obviously a health professional that is an expert in Parkinson will know how to recognize these moments, and hopefully will give you some space there. Reduce the duration of, so imagine, again, I'm giving you an example. Most people are doing exercise classes. That's why I'm using that example. And sometimes in a group setting, it's much harder for people to adjust and change things because then they feel out of place. And so it's just like, I can maybe ask permission for the teacher if she doesn't mind. Maybe I can leave 15 minutes before, so I'm reducing the time. Maybe I can go to more classes to compensate, but less time. So maybe I'll stay for 30 minutes and I'll take a class after when I feel better. Having more breaks, tough one in groups. Again, the pressure. I think, for example, in anyone that's doing boxing, usually it's done in a circuit kind of scenario. And maybe we can create a circuit there for breaks. What do you think? This is the break place where people can go rest without feeling frustrated with it. Increasing gradually, it feeling better. Okay, which means I might have moments, I might have weeks, I might have days, I might have hours where I need to adjust this intensity in this dosage. But then that doesn't mean I won't be able to increase it again. That you can think about progressing and to get back.
It's a reset. It's not a permanent change.
I think it's just I think people do this naturally, which is just recognizing the limits of our body and being able to adjust. And above all, be surrounded by professionals and colleagues and peers that understand that, so that you don't feel pressured to, to use energy that you don't have. So timing of the sessions, as I mentioned before, there's a recommendation that you'll hear from most professionals, which is try to exercise when you're best on. So it's like when the medication is working at its best, and avoiding when you're tired. Okay, as I recognize as a professional, it doesn't always happen that way. So sometimes people might need to be on. They might need their medication to be on to be able to get to the place, to the gym. And maybe by the time, if they're taking like 1 hour on their way or 30 minutes, that could be enough that when you get to the gym, and maybe with the stress of the cars and all the driving and parking and all that stuff, and then the medication's not working. Right? So it's not easy for us to just say work on your arm when you're best. And actually, some people even feel the benefit. For example, in the morning, before they take the medication, they actually might feel that they feel better than when they start taking the medication, which is an effect that is recognized as sleep benefit. So you've had this benefit of sleep, and then those moments before, and then you take the medication, then you start your day normally, right? But so it's not as, we can't be rigorous on these things, and there's always a need to adapt to the person. And then, what we have here is adjusting movements. So replacing complex movements with safer alternatives, which means what? It means that if I am doing like my lethal and big exercises, and for some reason in the middle of that class, my medication starts wearing off, maybe I can go closer to a wall, for example. And by having the wall behind me, it gives me a more sense of safety. Now you might say, but I don't have balance issues. That's okay. But in the moment where the medication is not working so well, your brain is programmed to keep you safe, right? And the rigidity is telling you to stop, right? And it's making you slower, which means sometimes just having a reference and giving some comfort, and this notion of comfort will allow you to continue the class without, or that's when the options, when sometimes people, why don't you sit down and do this in sitting position, right? That is an example about how people would adapt it. And let me see if I'm missing something. So yes, so just that, giving the sense of safety to the brain is very important. If I'm leading a group and something like this happens as a professional, and being able to identify it, I might change the exercises myself, but that of course I cannot impose on other colleagues. It's so if I'm teaching something, a boxing movement, and for some reason I see I have a person that's going down, what I'll do, I'll just change the type of activity and the complexity above all. Because if we reduce the complexity, the person might be able to continue. But if we keep increasing and increasing more, it will be more challenging. Okay, so hopefully I gave you an example. I have the format is like how I do it, and the type of activity. Okay. This must make sense to everyone? All good?
Yeah.
Okay, let's brainstorm some more together. So if I'm thinking about the format, how are we going to change it? Switching to group classes or not? So it's I always have to think about the most common situation is people are doing maybe exercises in their communities at this moment, and then they might have one-on-one with an exercise professional or physiotherapist. So here is just making sure that in whatever format you are in, the professional knows that this is happening. An option that I heard very interesting is like exercising at home. So the person says, I wasn't able to be every time I went to the gym, so I just started doing exercise at home. So these are all suggestions that people use. And then, so at home, sometimes we are alone, but there is a lot of online options at this moment that people can go to. Let me see if something that I've missed, changing the type of modality. So if I feel that I really have to exercise when my medication is not working so well, because, that's the only time that I have before my kids come in or my grandkids, and so maybe I can just think about things that will tire me less. So maybe instead of doing a power walk, maybe I can do a cycling, something that transmits, again, the word safety. less energy. If you are against gravity, if you are in a standing position, you will require more focus and more resources. So a good alternative would always be to either do something sitting down or even lying down. Okay. And of course, let's be logical. If this is happening, please do reach out to your neurologist and try to see all those options that you saw that in the beginning I said about the medication, if there's something that he can suggest. I've heard of people taking extra medication when they're going in exercise. I still have mixed feelings about that. I'm concerned that the brain might get a little confused about the timings, but I do know people do it, and we have to accept that people will control the quality of their life according to those decisions. Unfortunately, science cannot comment still on that.
Not yet. Yeah.
Yeah, that's soon. And then these information that I've been sharing with you of what might this wearing off be, if people are able to recognize this, then they know, you know what, I'm not feeling really well, and okay, I know what this is. This is my medication that's still not kicking in for some reason. And so I will try to take these strategies that we've discussed.
Someone's saying that it's difficult for them to duck out of their water exercise group. It's a 45-minute exercise.
That's a good one.
Yeah, so it's hard to do that discreetly. What would they do? Would they just kind of do their own thing and maybe not work as hard? You feel always ready to leak, or
I would start off by telling that to the instructor, right? That's there, and hopefully there's good sense with that, so that you feel at least the instructor knows that you are going to take it at your own pace, or that you are leaving earlier. And then the peers, I think peer pressure, usually people are so engaged in the water and there's just so much noise, they might not even notice that you leave. I teach hydrotherapy, so I can comment on that. And so that's a tough one for sure. But, feeling the pressure of the group, that's one of the benefits that we feel of doing exercise in groups, is because people are seeing others do it, so they tend to do more. So it's actually helpful to push a little bit more.
It's a bit of accountability.
Yeah, but I think it's just being reasonable in terms of the talking with the professionals, and they can help you brainstorm on how. Okay, if everyone's doing good, I will try to rush up, so I don't want to delay us too much. If you ever, so one of the questions that we put in the survey, just of interest to understand if you felt that your medication wasn't working during exercise, what did you do? What did you change? So these were the answers that we got. So some people stated, I slowed down or tried again later. Good sense. And then more water. Okay, that's very interesting. So that's a good way to I would say, run away from the class. I have to go get water. That's always go drink water is a good break. And then talk to my doctor and made a change in medication. We had someone that shared with us that sometimes in the YMCA adult schedule is drastically shuffled in favor of children's programs, and my medication schedule can't sync. I have to play without my medication on time, and it's obvious to the others that I'm struggling. Okay. That's a tough one.
Yeah,
boss.
I mean, you run into that a little bit with the trampoline when you're there at certain times of the day.
What I would do in the situation is try to see if discuss this with your neurologist and see if there's something that he can do in terms of the intervals of the timings, even if you start an hour early or something that would help you have the medication more effectively. And then don't feel it works at all. So there's exceptions. The medication is a world, right? There's so many ways it can impact people's lives. So we couldn't discuss everything, but we have your general medication, carbidopa, which is most common, works well. If not, I take an extra pill. As I was saying before, there are people that take extra pills. It is important that you discuss that strategy with your neurologist and that he feels open to discuss that with you. Okay, so how about unpredictable? So we know the disease is a challenge, it progresses, and then we have those intervals that we can more or less predict, and so we can put our activities in the middle of those intervals when they are happening. And there are situations when the person suddenly there's a change, and you don't know why. And there are several factors that can cause this. So when there's an overload in the system, imagine extreme anxiety. And extreme anxiety can be different for everyone, right? So a dog barking could be enough to irritate someone and to maybe have an impact on walking, right? walking and talking with someone and someone is talking about something very emotional, that's enough to trigger these episodes where the medication might just not work so well. Extreme fatigue, I think, is logical. This list can go on. You can have a bad night of sleep and you just feel that the rest of the day is just not the same. And inactivity. But these are the key ones that we know may trigger unexpected changes. My hope is that if people are aware of them, they might oh yes, I know why I was like that. I had a fight with my husband and then after I wasn't so good. Can we think about specifically in this situation? I won't go through the whole checklist, but just specifically thinking about if I have unexpected periods of, what they call off, so the medication not working so well. I don't know, maybe you had a large meal and you took your medication and it didn't work so well. And you have to go exercise, or well, hopefully not, but you have a situation where you have to do exercise and this is happening. What precautions can we take is one, identifying things that might trigger you specifically. Each person might have different ones or more emotional or not. And learning to recognize those early signs, as we said, maybe my tremors, maybe I'm more slow in those moments. And then trying to adapt, okay, if I'm going to the gym and something like this happens, I would recommend that you wouldn't think of, I have to do exactly the same thing that I did the day before, right? Because I think that's where flexibility is very important, is me comparing myself to the day before, me comparing myself with 5 years ago, me comparing myself with. It's in that moment, that's how you feel. And am I able to maybe do 30 minutes on the treadmill versus let me do 10 minutes on the treadmill, 10 minutes on the elliptic, 10 minutes on the bicycle. And you know what? You've got your 30 minutes of aerobic exercise the same. Right? So it's feeling that's not feeling secure that you can change the exercise without hurting yourself. It's not hurting. Without feeling that you failed on your exercise and your fight against Parkinson.
Losing any of the benefits.
Yeah.
Sure.
Feeling confident in what you are doing and that it's okay to change it. And obviously, again, when we're talking about medication, we're talking about a good conversation with your neurologist, because there are lots of options and there's this thing called rescue medication. If the person has sudden offs, that also solves this problem. And I'm only mentioning this because we are talking about the specific problem. Okay, so hopefully, any questions? All good?
Nope, I'm watching them. We're good.
Let's go.
How I recognize that we're off.
How do you recognize that? Is that correct?
Yes, that's the
Yes. Okay, so imagine when you were diagnosed, there was specific symptoms that are marked for you. Like I had tremor in my right hand. And what tends to happen is that those symptoms that you have with Parkinson will tend to be slightly worse in those moments. So if it was about you just not moving your arm while you were walking, maybe that will be more severe. If it's the fatigue, so it's whatever symptom that you have in Parkinson, it will be that one that will probably be the first one to show up.
There's other ones there, but it's the first one that kind of gets uncovered by the water level going down a little bit.
And it's usually the tremor, the slow movement, the anxiety. The anxiety is a lot of things, right? Anxiety can have a different impact on different people, but usually the person just feeling at rest, like they have to move. They're not feeling themselves.
How do you determine if the anxiety is based on not enough medication in your system, or
something outside?
Take like a rescue tablet, or just general anxiety?
Yeah. The way I would distinguish is if it's related to the time of the medication, right? So the only way you can know is this the moment where I usually take my medication versus if it's some other moment, end of the day. So it's just, if anything new happens, always try to think, wait a minute, how much time has passed since I took my medication? And there's this interval that we usually talk about, 30 minutes before and 30 minutes after. Because in the moment that you take your medication, you need time for it to start making effect. As I said before, some people might not even notice it. I take the medication, I don't notice this. Okay, that's the goal, is that people don't notice. But it's that interval around the taking of the medication that you'll feel this. That's how you distinguish.
And if it's there throughout the day, that might also be. I mean, this should be episodic, or at least increased during the off periods.
Yeah, because I know anxiety is something that has
It's gonna-
A
continuous.
couple of situations recently where I can't get to sleep at all. And then, and then after I take a medication, the
Carbidopa, levodopa.
yes, sir, that's one. Thank you. Uh,
So you'll see.
it's sort of tremors sort of hit automatically, or what I call an antsy or uneasy kind of feeling back and forth. Is that the medication not taking effect soon enough, or?
So you feel unstable when you take it and you have to wait a few minutes before you feel good. Is that what I'm reading? Is that what I heard, understood?
I think it's different. I think he's saying that he takes the pill and he has a little bit of that kind of akathisia kind of feeling where it feels like he's getting a little bit.
Yeah,
That's actually things spinning up.
and it's almost right away. It's almost so. I wonder how the body even knows that it started a new clock, if you will.
Yeah. We'd start off by trying to understand exactly what type of movements it is and what type of feeling.
Yeah.
That we can either relate it to the medication or not, right? I'd have to get a better description on what you are describing in order to comment.
Yeah, maybe to be continued when
Yeah.
we see you in class. There's another comment there too that says increased urge to pee is another one of early signs of off time,
Yeah.
and that makes common. Changes in temperature, the pain, maybe some of the anxiety, and then something like this makes total sense.
Reason why many people have to, during the night they have to go more times than they go during the day, right?
Yeah, I get that.
Yeah.
Which is cruel, right? Because it's when you're trying to sleep. And if you think about the interval of medication that usually the doctors do throughout the day every 4 hours or every 5 hours or every 3 hours. And then during the night, suddenly you have like 12 hours or 8 hours without anything, right? So we must think about, usually you have obviously medication that will prolong that effect. So there are solutions. Do discuss this with your neurologist. There are solutions for that.
And that might be something to consider when you talk about it with your doctor, which is that
Yeah.
a controlled release formulation like Rytary or Crexont isn't going to have that big ramping up spike like when she had that graphic and you had all those pulsatile dopamine. If you take a version that's more controlled release, it might not come on as hard and it might mitigate some of that kind of antsy feeling you're talking about.
Okay. So let's actually dive into these situations where it's crisis situations. So it's like we are more or less talking about it's like situations that are not expected and then they happen. Let me give you some examples of what that might be. And there's lots of things that might trigger this. And let's think, and I think it's one of the most important things that we can tell people. It's just knowing that if there is I think the most important one is here in the bottom, where there might be an underlying issue, like an underlying infection, like if you have a urinary infection or respiratory, and that makes all the symptoms worse. And so you were doing well, and then suddenly there's a major change in how you were doing. This is what we call crisis situations. So it's not expected. There should be a reason why this is happening, and the most important action is to quickly discover which one it is. And of course, you won't do it on your own. That's where the doctors and the health professionals need to help you. All health professionals should know this, that there are triggers that might create these acute situations. And the quicker we can find out what is causing the problem, the sudden change, and the quicker you act on it, the quicker you get back to where you were. Okay, that's important. That's why it's so important. So maybe changing medication, the doctors try some new medication, and then unfortunately it has some reaction specifically to you that's not supposed to happen, and going to the doctor and asking, okay, what can I expect? And if that should happen, what should I do? It's important to do this, right? To know this. Identifying depression and anxiety, when there is something that might be causing more depression and anxiety, then all your symptoms also get worse. Even cognition, right? Cognition, that symptoms like, why is the person having so much cognitive issues? And maybe it's just an underlying depression that's causing it. So there's lots of that we can talk about here, but I'm trying to keep it connected to our talk. So what can we do about this? If this should happen and I need to exercise, what can I do, right? If I have a crisis situation, I should try to get to the underlying cause as quickly as possible, as I said. But sometimes waiting for the neurologist is a month, is 2 months. unfortunately, it's not immediate, right? If you do have severe changes, I don't know if people can just go to the emergency at your, but it's not really optimal for Parkinson. If you can really reach out to your neurologist, that would be better.
I would start with my chart and then get to the nurse. And if you have a real crisis, you call rather than my chart and just get that going. But
Yeah. So, but the idea in the talk here is like, okay, so if I am dealing with this, okay, depending on whatever crisis we are talking about, right? Imagine if it is a urine infection, to go and exercise when you're feeling so low in terms of energy is not really wise because your system is fighting against an infection, right? That's why it says it's more urgent to treat the cause. But of course, there's always recommendations in terms of if you are able to just reduce the dosage of what you are doing. My greatest, I think, recommendation would be try to keep active because even when we have severe fever and stuff, some movement brings a lot of comfort to the body. So just trying to be active, which means less time sitting, I think is helpful in these situations. It actually helps the situation better. So if we have something that is, I don't know, making us see things that we're not supposed to be seeing, and from experience that I've had by doing movements, sometimes our brains is playing tricks on us, and by using exercise as a distracting factor, you focus your attention on that, and it actually helps you endure that situation better. Okay, so. And there's no research to back this up. This is experience that I've had.
yeah, I mean, when there is no research,
Yeah.
that's when clinical experience takes over, I think.
Yeah. So I'm imagining in these situations, people will have good sense. If I don't have the energy to go into a boxing class, on that day, I won't do it. But maybe I can do something lower energy, like a Tai Chi class or something, or even online if I can't get out.
Yeah.
Or yoga or something that you feel that you can do it. And this is actually where I want to go into now. It's like thinking of specific crisis, so cognitive crisis that might have fluctuations.
Just to coming in from Sonia, who's with the IPMDC. So what she's saying is that they usually ask the person to see their primary care provider or urgent care where you have a sudden change. Those are the people that are going to be your boots on the ground, and then let the doctor know and see if there's something that needs to be addressed. That's good advice. Don't wait. Definitely. We ran into somebody yesterday in my classes, and he's like, I don't see my doctors till November. We're like, no.
Yeah. And it actually made me think about this. Okay, so while the person is waiting, what can he do?
Yeah.
Okay, so it's like, I think these things are very, sometimes I think logic, but it's worth us writing them down and you guys can check it out better, which is really simplifying things. If you are, imagine exercising with someone, imagine it's a family that's helping, someone in the family is helping you. It's good for them to know that, maybe how I give the instructions is a major issue in cognition, right? The tone of voice that I use, the amount of times that I repeat it, the not correcting continuously. These aren't just tips that I can give you that it can be very frustrating if you are already feeling confused and then someone is actually pressuring to do something. And okay, I think let's fast forward. Depression and anxiety. So again, crisis, there's a sudden change in depression and anxiety. Same actions as we say, like try to find out why this is happening. This one is tricky because, depression kind of like sneaks up on you and people might not notice, because when I talk about a sudden change, it can have lots of meanings. It can be in a day, it can be in a week. Usually a doctor will consider a major change if it's lasts more than 3 days. It's based on the assessments that they do. It's having an impact on your life more than 3 days. Then it's like you saying we have a problem. For depression and anxiety, it's interesting because it's more about, I do the boxing. I don't feel I can really do it because I don't have the energy for it. Maybe I'll try something else. So maybe a walk or something, preferable a walk in nature, tends to have lots of research to support its benefits over depression. Just being more realistic and above all, being flexible with yourself in terms of those adaptations. You can feel comfortable that if you're in a situation of depression and anxiety, the best research suggests that any type of exercise, moderate, high, low, will have a positive effect on your mood. Okay, so we don't want to create too many rules when the person is highly depressed in terms of, no, you know what, the best exercise is for you to do boxing or swimming or whatever, and the person just is not there. right? So it's just moving will be very beneficial in these situations.
This is where I think reducing the friction, as we like to say, reducing the barriers. That's where a good thing can happen with with an online class or something like that.
And good. How about sleep? Okay, I've had a really bad night's sleep and now I have to go exercise. A tough one. When somebody comes into the gym and they don't look so good, and it's like, how was your night? It's always my first question. Someone shared with us one problem I have is really encountered in sleep disturbance, which makes me slack off in the daytime. So it's something, irregular sleep problems affects diabetes, energy, and focus, right? I think we can relate to that if we look up. I think one way to deal with fatigue and exercise is really have those like exercise snacks, so just do shorter periods of movement and exercise according to your levels of fatigue. Maybe think about in the morning, I'm able to do more exercise than actually at the end of the day when I've already done so much, that I've already had so many interactions, because talking also is fatiguing, right?
For some of us.
I wanted to go into an example that people refer a lot, especially young onset, so people that were diagnosed below 50 or 45, and which is really, unfortunately, it can be, so dystonia is a contraction of the muscles, involuntary contraction. It can be related to the medication or not. And so obviously the first way to tackle this is to discuss this with your doctor. What I was thinking here in terms of how can we help people, it's just recognizing the issue, recognizing that this happens, and that people might feel sometimes when they wake up in the morning that their feet are more curled up, and it even has an impact on walking. But if this happens in a time where you actually have to exercise, it might be challenging. So it's just keeping safe is important to highlight that this can happen. Adjusting, obviously, the type of exercise that we do. I know there's even a thing called exercise-induced dystonia. So that means the person is doing a specific exercise and the dystonia comes on. And that one is quite challenging because you have to really change the type of exercise that the person is doing and see how long you can do the exercise without this happening. So there is always something that you can do. It's a challenging issue, but but there is ways for us to bypass it.
Someone's coming here that doesn't want to climb rocks, do the rock climbing with the toe curling, and that's a good example. Now, it can be an off-period focal dystonia, meaning it happens when the medications are wearing off, and you might be able to get around that. But if that's a sore point, it's not a good one. Hand problems to same situation. It might be not the best exercise.
If this is a situation that's happening, if we use them like, okay, do I feel safe when I'm doing the exercise? How do I feel during and after the exercise? Is one of the safety questions that I showed with you. So I'm wondering what the impact would be of after climbing, or if you have climbed before, what happened to that dystonia? Did it go away? Because sometimes it can be the trigger before. And if it didn't go away, it just makes you feel unsafe during the climbing, which might be the case that you are reporting. And in that case, different options, different time.
Actually, I look, they always have ropes and everything.
Yeah.
Those things are going to let you fall.
Another challenging one is that we know that there might be movements that are associated to the use of the medication, right? So it's this is just an example about if there are movements specifically related to when the medication is kicking in and the person is trying to do exercise, we can all imagine that must be challenging. What can we do? Can probably do exercises that are on the floor, exercises on the chair. But now imagine this is a 45-year-old person and she doesn't like to do exercises on the floor. So she wants to feel the intensity of the exercise, right? And this is where being flexible with ourselves and then finding new ways. She would tell me that she would have these movements on the way to the gym. And so coordinating the medication time with the time. And then now, so she just decided to buy a treadmill and do it at home, right? So being agile, thinking of finding ways to be able to bypass the problems. Another situation that was highlighted in the questionnaires was basically, okay, so after hospitalization, this would be a very common one. What can we do? Let me just go quickly through it because I think it's pretty, I hope it's standard procedure that people, when they get out of the hospital, independently of the situation that they had, that they will have a rehab program, right? They will have an exercise program. If you don't ask for one, I think the professionals that are there around you can really guide you on what can I do at home and what can't I do, and if I want to do this. So challenge the professionals around you. As safety, obviously, if you depending on the situation, it's like safety will have to definitely be a priority. And then knowing that if we were in bed for a long time, for some time, there's changes in our body, in our muscles and everything. So there has to be an adaptation to that, and just be patient with yourself to be able to go back to where you were, right? Because that is the hope. And then obviously one of the interventions where people might use most to not feel so tired, it's a good way to fight against fatigue, is hydrotherapy. The only issue is that it's so exhausting to just get dressed and undressed and shower, right? So, so it is a good place where people can do exercise without feeling so fatigued. The movements are lighter, the benefits are really good, the evidence is really strong. But I do feel the barrier of people having to go to a pool to get dressed, undressed, and then to get dressed when they're wet, which is tremendously difficult. Okay, and obviously just keeping a highlight here for nutrition. After a fall, which was recommended as well, there I would just, guide you to, there are falls programs very specific to why you fell. So if it was because of the freezing, you will have one program. If it was because of the balance, you'll have another program. So here you really need to get some guidance from health professionals and to understand what type of things that you should do. Okay, just jumping on to what would other comorbidities be. So stuff that I'd say unfortunate of life and new challenges. And so if that should happen, if we have new situations, what can we do about it? Let's think about specific situations, like if we get a new diagnosis of something like cancer, and what can we expect. That usually what we relate to the treatments that people have to undergo is really the fatigue. So the increase of fatigue, and now it will limit how much exercise I will do. And so the fear is, now how's my Parkinson going to play in this new role, right? So it's, as I was showing you before, it's like it's a new way, and Parkinson is with you on that road, right? So it's let's think about things that we can try to reflect on, and that might be helpful, right? So choosing the right timing. I think the most important one of all the lists that I see there is just being able to recognize your limits, and being able to recognize that you are fighting against a new thing. So it's not how I'm losing something in the progression of the disease of Parkinson. You have a new issue that will lead you in a different way of progression. So by fighting against that, you are doing your best against the progression of Parkinson, right? By fighting whatever is in front of you. I'm sorry for the word of fighting. Sometimes it's not well received. So choosing the right timing in terms of exercises. Here we're focusing a lot about the fatigue will probably be the issue. So doing shorter periods of exercise, increasing the frequency that you do it, and just doing it according to your fatigue levels. Okay.
One thing to mention here too is a lot of these things, like some of the effects of the chemo or radiation or drugs that you take for immunosuppression, might have some influence on your cognition, which is also going to influence how you're going to do the exercises, and you might need to dial back a little bit or find the best times to do the exercises.
Mm-hmm. And I think knowledge should help us just know that these are issues that I might be dealing with. There's a reason why I'm dealing with this. And there's a reason why I'm adapting it. And so there's a reason why I'm not in the same class that I used to be.
Well, and hopefully this is a temporary thing. I mean, when people talk about fighting Parkinson's, some people don't like that imagery, but I think you look at fighting cancer, that is great imagery, because you're going to win and you're going to get on the other side of it, and then you're going to go back to dealing with the long-term problems, right? This is a get in there and attack it. With Parkinson's, I think it's much more of it. We're going to.
People might feel that, but it's, I think, again, knowing what we expect and what I can do. You can only do what you can do.
Mm-hmm.
And so it's feeling comfortable that you are doing the best that you can do.
Sure.
And you can only do that if you have that knowledge, right? It's,
yeah, I guess it's
sometimes the access to knowledge is a pity that people don't have that. So let's think about prioritizing safety. Yes, progressing the types of training. As I said, if the fatigue is an issue, in this case, I probably wouldn't recommend hydrotherapy, because there's a lot of in terms of immune system, and the pools might not have the right hygiene. It's crowded places. So unfortunately, unless you have a private pool, that would be my recommendation.
I encourage you to get your insurance company to pay for that. That would be a great idea.
Yeah, it's just being mindful of, of the infection risks that might have. And then monitoring intensity, I think that is good sense. Okay, relaxation techniques. And because I know this is a very specific issue, we did want to leave you with the hope that there are very specific guidelines according to what type of situation of cancer that you might be dealing with. So I was very happy to see that there was a lot of dedication to exercise in these situations. And so this is in case you want to dive deeper into it and you feel that need. If in any way we can help, please do reach out to us.
For sure.
Okay, I'm going to rush through this one because I'm probably over time already. A little bit? Okay. So orthopedic problems, I think everyone, unfortunately, this one is pretty obvious, like getting professionals. If I broke my arm or something, and then I really like going to the boxing class, I hope that people feel comfortable of going the same. Maybe you're not going to do the same thing, but being in the community usually is very good on mood, right? So depression, anxiety, and the sense of community. And it's like, if I go and I feel sad because I'm not participating, that means it's having a negative impact on my mood, right? But hopefully we can find other ways to integrate even when people have issues like this.
So if I more stuff, bigger gloves.
Yeah, break my leg, but maybe I can do a sitting class where I'm using my arms and participate the same. And the specific recommendations also obviously for diabetes is just having another variable on top of the table, which is checking your blood sugar. I think would be the most important thing to highlight here in our list. But then you can easily go through it. And again, it goes back to not being caught by surprise with low blood pressure and the fatigue that it might cause. Unfortunately, we know when we have diabetes, the symptoms tend to be worse in Parkinson's. And I could go on because the list is enormous, right, guys?
Yeah.
In terms of the amount of problems that can happen. But hopefully the checklist that I gave you helps you, take whatever situation you're dealing with, just go through it and calmly see, can I adjust this or that? And I really hope it's useful. The idea behind this talk was really to transmit that we are very secure in recommending the type of exercises that you do, but we still lacking knowledge about how to help you change that when something happens or when a specific problem or symptom is present. And I hope that we're saying that we are working on it as health professionals and as researchers as well. I hope that some of the examples are useful and transmit you the idea that there's always something that we can do, right? That is really the key message. There is always something that we can do. And I hope that whatever happens does not discourage you from trying to get better solutions. If we have any specific questions that people would like to unmute, and there were other things that were shared in the questionnaires, and I think it was, hopefully we touched upon it through the talk. Thank you so much, guys, for coming in. And we really hope that you can use this information, and please reach out to us if there's something we can complement on.
Absolutely.